We know that medical students' life is very stressful and overwhelming. That's because of the workload involved in studying and in hospital training. What is important for a medical student is to take medicine as your passion. Once you take it up as a passion, you will never feel tired and you start loving the subject. Other important factor is to get involved in co-curricular and extracurricular activities. That will be a stress reliever for you, and it will also help you in a holistic development as a student. Once you become a doctor, always be a lifelong learner, which is a very important to be a successful professional. And small advices that once you become a doctor, have your friends outside medicine. Being human is more difficult than just becoming a human being. And retain your humility throughout your life.
Hi, my dear students. I'm going to talk to you something related to Doctor's Day celebrations. And also I would like to convey a small message to you all. July 1st, all over the India, this day is celebrated as Doctor's Day. It's also popularly called as Dr. B.C. Roy's Day. B.C. Roy is a surgeon, physician, educationist, and also a politician. He came up with his hard work and dedication. So firstly, let me congratulate all of you because you have joined the very prestigious institution, Kasturba Medical College, Manipal. Remember, it's always within 10th out of 700 medical colleges in India. So you have some responsibility, which I would like to convey my message to you. Strictly follow the dress code, which has been suggested to you both inside and outside the campus, so that you will also behave in a responsible way, so that your acts should not tarnish the image of the institution. Actively participate in learning and teaching what is going on in the classrooms. Participate well so that you talk to your teachers, ask questions so that you can learn better. You have one of the best museums here. Always, not listening, seeing is believing. Go see the museum, utilize it. Libraries, another area where you will get plenty of books. Yes, you need to time your, whole program. You have to have studies. You also should have extracurricular activities. In fact, Harvard School recently introduces dance, music, literature, etc., which Kasturba Medical College has been doing for last, several decades. So participate equally in your extracurricular activities too. Now, when it comes to the ward, that's one of the important areas. The clinical material is in plenty in Kasturba Medical College and Kasturba Hospital. Remember one thing, clinical or bedside material is always learned bedside, not book side. So when it comes to the wards, you have to be well disciplined, punctual, and start developing those skills. As you complete your education, you should also develop what has been called as psychomotor skills, and these are very, very important for you to come out successfully from this institution. So this is a message to you, all of you, on this day, Doctor's Day. Happy Doctor's Day. Thank you, Cutting Edge, for giving me this opportunity. Bye.
Hello everyone. First of all, I would like to thank Cutting Edge for giving me this opportunity to talk to all of you on Doctor's Day, July 1st. And of course, all of you know that Doctor's Day represents the birthday of a very eminent doctor, Dr. B.C. Roy. And not only was he an eminent doctor, but he was also a very famous political figure in his own right. He was the first chief minister of West Bengal. And interestingly enough, he also died on the same day, July 1st. And Doctor's Day is a day to commemorate or to celebrate healthcare professionals and their contributions to society. And what I would like to tell the budding doctors, that is the medical students, is that When you come to the hospital, when you enter the four corners of a hospital, you are going to encounter patients who are going to suffer from a variety of disease, and they are going to express all the possible range of human emotions that a human is capable of, from fear, anxiety, depression, laughter. So as a medical student, one of the things that you should learn to do is to empathize with them. Not sympathize, but empathize. This is a very important trait that you have to learn to develop. Empathy means to learning to understand and share their emotions, as opposed to sympathy. There was a questionnaire that was given out to medical students in Ireland about 7 or 8 years back, asking them what is the one quality or trait that a medical student should possess when they come to a hospital, and they've all agreed that it is empathy. And the other thing that I would like to tell all of you is medical ethics. Please practice ethics in medicine. When you're dealing with patients, when you're dealing with your fellow colleagues, when you're dealing with society, uphold medical ethics as you traverse through the field of medicine. Thank you.
Hello, I would like advocate MBBS students to practice suturing and knotting on suture board, and practice correct way of the beginning process will be like wearing a glove, and then there are several knots, but the most important is learning how to knot a surgical knot. You can practice these steps by watching on YouTube. Once you are perfect, you will get a chance to do it on a patient. When you conduct deliveries as an obstetrician, you will get opportunity to suture episiotomy, and there are plenty of cesarean where you can approximate the skin by cosmetic subcuticular suture. We would advocate you to take up OBGYN as during your post-graduation, so that we can guide you properly to hone your surgical skills.
A very happy Doctor's Day to all our budding doctors. I want to congratulate all our students who have taken up this noble profession. Yes, you have taken a step ahead from all your other friends in other fields, because this profession needs a lot of hard work, determination, empathy, and a long tenure of learning. Now in medical school, I want all our students to develop good basics, because if you have strong basic education, you will be a very good doctor. You can always update yourself with the recent advances. Once you finish your medical like MBBS, make sure you all join one of the medical association like our Indian Medical Association. If you join a post-graduation, that's specialty association, because these associations will help you whenever you need them. Also, you have to have your indemnity insurance, you have to have your other life cover insurance, because with the current scenario of medical practice, you have to be honest, you have to be sincere, you have to know the legal aspects of medical profession, and also be safe. I wish all our budding doctors a safe, stress-free and successful professional career. All the best.
Hello everyone. To begin with, I'd like to thank my alma mater KMC for what I am today. It's been a privilege working as a faculty in this institute, an institute of eminence. I extend my warm wishes to my colleagues and students, that is future doctors, on Doctor's Day. Hope as part of the medical community, we continue to serve our patients towards their well-being, and we hope to continue to update ourselves towards the new developments in our respective fields, so that we may be able to do justice to our profession.
Thank you. My message to all of you on the Doctor's Day is work hard, remain focused throughout your 4.5 years, and especially during the internship. This is a profession of patience and perseverance. Here, every day will start with 0, it will end at 100. So you need not to lose heart. Every day strive hard to learn something new, because you have to find out at the end of the day, what did I learn new? in this profession, you are going to get the fruits of satisfaction, a different level of joy and happiness after a couple of years. Probably initial years are extremely hard, some days are very depressing, but only at the end of probably few years you'll realize that this gives you a different level of satisfaction, the happiness, a joy which is unparalleled. No other profession will ever give you this satisfaction.
You probably aspire to be good surgeons. That is why you are in this team, which is called as cutting edge, and you want to learn the surgical skills and teach the surgical skills as well. So when it comes to surgery, according to me, it is an art. Surgery is an art. Okay, it is like an artist doing that fine drawing and then seeing and then giving the final touch and all that. Okay, so it is as you do surgeries also, what I tell my students is that you should work in the planes, tissue planes. You should spaces. Okay, in the spaces. It is not that whatever you get, you can cut and you can dissect and all that. Dissection should happen in the normal physiological planes. Okay, you always get some good surgical planes and you should dissect in those planes. That will result in good recovery and good outcome of your surgery.
Hi students, this is regarding a small message from me from my experience. I would like you all to look at patients as human beings first. Please understand that apart from the disease for which they have come to you for treatment, apart from the medical, the pathology, the pharmacology and other things involved, there is another aspect of the fact that they have got a family to take care of, they have to go back home on time, they have got their personal problems in life, their job and a lot of other things. So please take that into consideration when you treat them, and be very careful about how you deal with their feelings. You don't want to hurt that. Thank you.